Unruly lasers, cuddly livers, and the old tomahawk chop. What? Get ready to laugh because today we are breaking down and reacting to all of the highly incorrect medical scenes and over-the-top injuries from PewDiePie's master surgeon. All right, let's dive right in.
Work it. How's it going, guys? My name is PewDiePie. We're gonna do the kidney transplant. Yes, I read your bros' comments, and I think we're ready for this, aren't we, Bob? You're in my domain now, bitch.
Oh my gosh. Any surgeon actually going to the operating room likes to have it serious but lighthearted. There's sometimes music playing in the background. You wouldn't have the abdomen totally open, but obviously this is just a show. Kidney transplants having to do with the fact that somebody's kidneys are not functioning. They'll probably be on dialysis.
So a lot of you bros said that you don't want me as your surgeon. Don't make me slap you again. Don't make me slap you. I don't really get what you mean by that. Nah, don't fight me, lightsaber. Oh, sorry about that, Bobby. Burn his nipples a little bit.
Doctors have been caught on camera being unprofessional, and then they can actually lose their job, lose their license. And obviously this urologist would not be using one of those mirrored lights on the forehead. They do not need that.
Nice and easy. There we go. Oh, shit. Sorry about that, Bobby bro. Where did the laser go? No! Ah! Hey, ow! Not on me. Ah, Bob, calm down. Off with the laser. Off with the laser.
If you take your finger off the button, they typically will stop. They just don't fly around like that, and they have like automatic shut-off switches.
Drill, did I tell you to start dancing? No, I did not. Let's grab this whole thing.
He just literally grabbed the large intestine. You don't want to just grab that and throw that out. The large intestine starts at the right lower quadrant, goes up, transverse colon all the way over, then goes down into rectum and out.
Oh, I love your new scarf, Bob. Oh.
If it does need to be removed, it's probably put in a biohazard bag. People always ask, can you get organs, limbs back? And the answer is probably yes. You just have to talk to the hospital and figure out the legality component of it.
Holy shit! What the?
Got a bleeder. Got a bleeder. What's happening?
I don't want to be a doctor anymore. Nope. Oh, don't you dare fight me!
When I was a resident, I've been in situations where the surgeon accidentally not expecting a vessel to be where it was, and the vessel gets nicked. Easy, control the bleeding, fix it, sew it back up. Doctors typically won't run away when the patient is dying.
Oh, yeah! That's right, I'm the boss of you. Oh, okay.
I've seen people throw tools or get frustrated or throw things on the ground because they're humans, but not organs.
Oh, okay. We can actually do that. Oh my god. Oh, don't you dare bleed on me, Bob. I will kill you if you die. Oh, it's a perfect match. That will make us a perfect match. We're like, not in. Oh, high five. That was awesome. Surgery complete. Looks fine to me. I'm sure it'll live.
It looks like he's got kidneys in the hand. You have two of them. They sit in the retroperitoneal space. You can live with just one. If they're not functioning, they can stay inside your body, but you need to have dialysis to clear out your blood because it's a filter system to keep certain electrolytes and get rid of other toxins, that sort of thing.
How you doing, Bob? How you doing? It's all gonna be good. You're in safe hands. Dr. Pewds is in the house?
Yeah, that's the phrase. Doctor's in the house. You wouldn't be rubbing the patient's face, would have a mask on, would have hair coverings. Anesthesiologist or the nurse anesthetist will be taking care of the airway as well as the anesthesia for the procedure.
All right, Bob, you may feel a slight pain in your chest area. Don't worry, it's normal. And if your balls tickle, that's normal too.
No, it would not be normal for doing a chest procedure and having any indication that your testicles would be tingling or uncomfortable. If you're having a heart surgery, the biggest thing you have to deal with is the cage, right? You have the rib cage, you have the sternum, you gotta get through that. So typically they're using a saw to cut through your sternum to open it up.
3, 1, 2, 3! Oh, whoa. That's how we do it in Piripatam.
That's definitely not how it's done. Sometimes a hammer is used, but you're actually hammering into another tool. You're not using it directly on the bone and shattering the bones. You're never gonna get those back into place.
What the fuck are you? The f are you? Is that his liver? They're cuddling.
The chest cavity and the abdominal cavity is separated by your diaphragm. And yes, your liver in your right upper quadrant is just underneath the ribs there.
High five. No? You b****. Don't make me slap you. I do believe this is how you hold the scissor. That's how they teach you in school, isn't it? Alright, Bob.
Actually, no. A lot of scissors actually have like extra places for your finger, like an extra finger, so you have better dexterity. But no, there's actually a specific way. And a lot of times you actually put your index finger really close to where it pivots, so you have a lot more control.
It's gonna Are you okay there?
I've dropped tools on the ground before. You just leave them. There's, redundancy of tools. You can actually use something else in case they drop to the floor. But now they're not sterile, so you can't use them.
Come on, baby.
Oh, and just throw away all the intestines. Okay.
All right, let's get the stomach out. There you go.
At least now we got some more realistic, some blood on his hand, even though it's a non-gloved hand and he's actually not scrubbed in. He's just wearing scrubs.
YOLO mode. Get that there. It's in. It's in. It's in.
Wow, look at the cavity, the hole basically of the patient. It's actually filled with blood. And a lot of times now that blood is starting to coagulate. You got to get that out so you can see what you're doing.
It's in, I tell you. It's in. What do you want from me? Calm down.
Wow.
That.
Yep, lost too much blood. Obviously, no heart there, so the patient dies. Brain transplant.
Wait, before I do anything, you see how it says Bob there?
It's actually good, but you need to identify the patient, make sure you have the right patient, right surgery. So Bob's head is shaved, ready to go for the surgery, which is quite common.
What? There's a tomahawk. Okay.
There's no tomahawks. Typically, these type of procedures, you're probably gonna have a very skilled saw.
You might feel a little headache, Bob, but that's normal. Tomahawk chop!
This is not what occurs in the operating room when you're under anesthesia and you don't know what's happening. The doctor will literally go over what they're going to do and explain to you the different steps.
Oh, no way. There's a brain in there. Oh, man. This... Done.
Look how small the brain is. You don't just smash into someone's brain. Obviously, you need to take the current brain out. And there's a lot of blood vessels and connectivity to it. No, it's called bedside manner. It's called composure, keeping what you're feeling in.
Better hurry up. Give me the drill.
And if you're bleeding that much too, you must have hit a major blood vessel.
I'm a professional. I can't work with this.
Patient's gonna die and bleed out.
Ah.
Yep, when you're just bleeding out, you can't just let it bleed while you're looking for something else. You need to have somebody either control the bleeding, hold it there while you're doing whatever you're doing, or vice versa.
Come on, baby. Bob, disco time. What the?
I've seen people come in who've gotten hit in the head with hammers and different objects. You know, it hurts, right? But the brain tissue itself is insensate. It does not have actually pain receptors to it.
You're gonna be so smart after this.
It's very intricate to reattach. They don't have the ability to do that currently. Taking things apart is probably easier. Very interesting. As always, if you guys enjoyed this, check out this playlist right here. Make sure you binge watch everything and make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching and stay healthy, my friends.